Pam, the law is basically changing the way that opioids will be prescribed in the state of Florida. Now, acute patients will be required to go and revisit a physician after 3 days of using up their pills. Now, this shouldn't affect those with chronic pain, but some are saying that it is. David Korn has been taking some form of opioids to ease his chronic pain since 1999 after herniating a disc in his back.
This oil extracts.
Korn also uses medical marijuana, but he still depends on Percocet for extreme pain.
It enables me to function more, it enables me to sleep better, it enables me to exist on a more normal level.
The former podiatrist says as a doctor and a patient, he disagrees with the new limitations on opioid doses.
People that are passing legislation like that don't have an appreciation of what it's like to live in pain, number one. They don't realize how difficult it is to treat pain as a physician, number two.
While chronic pain from cancer, terminal conditions, palliative care, and serious traumatic injuries are exempt from the new law, treatment is different for everyone.
Every patient is different the way they metabolize these medications, so at the end, we have to really evaluate each case by case. Now you can come down.
Dr. Eduardo Jusino works at the Spine and Wellness Centers of America in Lake Worth, where they use various methods to treat chronic pain.
So there's nothing acute.
He says the new regulations will streamline the process of prescribing controlled substances and document them appropriately.
At the end, I think that this will just help regulate like what we're doing with these medications and also pay more attention.
I think it's exciting.
Something Eddie Schmidt wished his son's doctor would have done.
This is one small accomplishment to try to control this particular drug that has been dished out like M&Ms.
We interviewed Schmidt back in April. His son Mark got hooked on opioids 7 years ago after taking the drugs to treat a sports injury.
That prescription was supposed to last me a month, and it was gone in 4 days.
Schmidt said if this law was passed when his son was injured, he wouldn't be an addict.
Absolutely. We wouldn't be here today.
I reached out to at least a dozen different pain management facilities and cancer treatment facilities to see how the law was affecting them. Some that did get back to me say that what it is doing is increasing the referrals that they're receiving from primary care physicians. We will continue to stay on this story as it develops. Jamil Donith, your South Florida.